SockIt oral hydrogel wound dressing with immediate dentures. SockIt used after tooth extractions for immediate dentures provides drug-free pain relief and helps to optimize the healing process. SockIt's easy to use, however, it is important to follow these simple instructions. First, you extract teeth and adjust dentures exactly as you normally would. And here's a photo of a newly edentulous person. Apply SockIt gel to the denture just prior to denture delivery. You don't need to apply SockIt directly to the extraction sites like you would with a single tooth extraction, for example. The gel will flow easily from the denture into the extraction sites. So it's very simple, just apply the gel directly to the denture. Application of SockIt immediately after tooth extraction is important because wounds should be dressed as quickly as possible to protect them from microbial contamination and growth. This is a concept that's emphasized increasingly by wound care specialists to help ensure optimal healing. Send the SockIt syringe with the remaining gel and the patient instruction sheet home with the patient. And it's very simple, just put it in a packet together, the instruction sheet and the syringe together. Very simple for the patient to take home. Okay, the SockIt gel will eventually wash out of the denture. It usually takes about 6 hours or so. The patient's going to know when it's gone because pain will increase dramatically. So instruct the patient to gently remove the denture when pain starts to increase. And I'm talking about the first 24 hours, so a paradigm shift here. We always have told patients not to take the dentures out the first 24 hours, but now I want you to tell them to take the denture out when they feel pain. Clean and dry the denture, apply SockIt gel to the denture, and place the denture back into the mouth. And this may need to be done a couple of times before the patient retires for the night, depending on the time of day the extractions took place. But don't worry, patients will not leave the denture out. They want the pain relief provided by SockIt. They can already tell that it's more comfortable to have the denture in place with the SockIt gel in place than it is to leave it out, so they will put the denture back in, and you want them to continue receiving the benefit of the SockIt. The patient's going to use SockIt as a pain gel the first day or so. However, SockIt is a wound dressing that protects wounds and helps optimize the healing process, so it's important for the patient to continue its use. The patient should continue to apply SockIt to the dentures every 6 hours or so until the syringe is empty, which usually takes 3 days or so, to continue the benefits of the gel. When used as directed, SockIt safely provides constant pain relief without numbness. It protects oral wounds from contamination, both chemical and microbial, and it helps to optimize the healing process. And that's really all there is to it. If you follow these simple instructions, you and your patients will be pleased with the benefits provided by SockIt in immediate dentures.